Cardio-Oncology looks a little different depending on where in the world you practice. Different populations, different systems, and different challenges. One of the sessions I'm most looking forward to at GCOS 2026 brings the global perspective together. I'm Abdelrahmen Ali, a third-year cardiology fellow at UTB Galveston, and today I'm joined by one of the speakers bringing the view from Japan and Asia Pacific. Dr. Eri Kato. She's the director of Cardio-Oncology Unit and senior lecturer at Kyoto University Hospital, where she also worked within the Institute for the Advancement of Clinical and Translational Science. She trained in some of the world-leading clinical trial groups, the Clinical Trial Service Unit at Oxford, the TIMI Study Group, and Harvard Medical School. And she holds an MPH from the Harvard School of Public Health. She served on the writing committee for both the Japanese oncocardiology guidelines and the 2025 Japanese heart failure guidelines. And she's the founder of Cardiovascular Link. Welcome, Dr. Kato.
Thank you, Abdelrahmen, for that kind introduction. I am very excited to join GCOS 2026 this year, and thank you so much for having this interview with me. Thank you.
It's our pleasure having you today. So let's just start with our questions. You're representing Japan and the Asia Pacific in one of the most anticipated sessions of this meeting. What's the story from your region that the rest of the world doesn't hear enough about?
Well, thank you so much for that question. I really love that question. And thank you so much for highlighting Asia, because Asia is home to about 60% of the world's population, as you know, and roughly half of all new cancer cases worldwide occur here in Asia Pacific. So Asia Pacific is an important region in terms of cardio-oncology. And in Japan, 50% of men and women are diagnosed with cancer once in their lifetime. And the leading cause of death is cancer, not cardiovascular disease, as it is in Europe or in the Americas. So oncology sits at the center of Japanese medicine, and cardiology has had to meet it there. So I think that partly explains why cardio-oncology took root here so quickly. When the Japanese Cardio-Oncology or Oncocardiology Society was founded in 2017, a remarkable proportion of our leadership came from oncology and hematology, and that shared table is part of why we've been able to move very quickly. And a great deal of high quality work comes from across the region. For example, registries, biomarker studies, long-term follow-up, and it's sustained by clinicians' commitment. And I think it deserves more attention than it gets. And then there is what's happening right now. Cancer survival across Asia is improving rapidly. And the population in several countries are aging faster than anywhere. And those two curves crossing is how you create a very large population of cancer survivors with cardiovascular disease. And much of the region is meeting that with health system that were never designed for it. So we have to do a lot. And that's one of the things that I like people to know. Not that our region is unique, but that it's large and it's changing quickly. And there's a lot we still don't understand about our own patients. And we'll be glad to work on that with colleagues around the world. Thanks.
That's amazing. And thanks for sharing these statistics with us about, the number of cancer, like the cancer population in Asia. But I guess that takes us to the next question. Like, where do you see the biggest gaps between international guidelines and what's actually like feasible or workable in Asia Pacific?
Yeah, that's a complex questions. But I think, anthracyclines are probably the easiest example. In Europe and North America, I think the field has moved away from anthracycline because of cardiotoxicity concerns. But anthracyclines are, good drugs and they work. And the data we're beginning to gather in Japan suggests CTRCD incidence here is considerably lower than the rates quoted in Western guidelines. So why? Probably because, our patients' risks are very different. For example, obesity prevalence is much lower in Japan, and baseline cardiovascular risk is lower. And of course, the same drug given to a lower risk population produces a different, CTR/CD incidence. So if we import a de-escalation strategy derived in a higher risk population, for example, from Europe or Americas, we may be depriving patients of a highly effective therapy to avoid a risk they don't carry to the same degree here in Asia Pacific. So we may need a genuinely different strategy, not a weaker one, but a better calibrated one, if I may say. And getting there requires regional data, which is precisely what we are doing right now. And the difference really runs deeper than the risk factors too. Of course, genetic background differs. For example, EGFR mutate lung cancer is far more common in East Asia than in the West. So we encounter cardiovascular we encounter, like, for example, thrombotic toxicities or cardiovascular toxicities more often and also more earlier than colleagues elsewhere. And that needs to be in the guideline. And the cancer landscape itself is, of course, different too. We have more gastric cancer here in Japan. And also, we do extensive national screening, which means many cancers are caught at an early stage. So different cancers, different treatments, different genes, different survivorship, and therefore, different strategies are needed, and different guidelines are needed. We are currently working on updating our Japanese cardio-oncology guidelines to incorporate more of that, more national data, more evidence to fit into our culture. So please do look forward to the upcoming updates. I think we'll be able to finish it next year, early next year.
Looking forward to them. So I guess one important questions, and you would be the best person to answer this. Like for early career cardiologists in the region, thinking about joining the fields, and they are aspiring for a field that's growing and exploding like the cardio-oncology field. What's your advice to them? What would you tell them? To kind of like attract them to join the field.
Yes, yes, that's an important question. So let's see, I would say three things. So first, this field never bores you. Oncology therapies are advancing every day. So which means the cardiovascular questions keep changing underneath you. So it will never bore you. And you'll see cases for which no textbook has an answer. If that sounds, stressful, it's the wrong field. But if it sounds interesting, it's the right one for you. So second, I would say the timing for Asian Pacific, specifically, I think the timing is generally in your favor because in much of Asian Pacific regions, cardio-oncology is still new. So that means if you start now, in 10 years, you'll be the leader for your region. You'll be the person your colleagues call, the person who builds service, the person who can tell you about, who can teach, who trains the next group. And very few fields still offer that. So I think it's a very exciting field. And third, so I would say, don't wait until you have perfect data or wait until you have perfect English. That's, Japanese and Asians are very modest, very shy. Don't wait for that before speaking up internationally. Our populations and our questions are underrepresented in the evidence base, and the field needs Asian Pacific voice more than it needs polished one. So I would definitely go for cardio-oncology.
That sounds amazing, and I hope that we will have a good representation in GCOS, from Asia, and then they will get to see firsthand what cardio-oncology has to offer. Before we end our interview today, would you like to add anything?
Yes, thank you. I forgot to say one thing. So I think this
Yeah.
is a perfect timing for Asian Pacific people and also people everywhere because GCOS 2027 will be held in Tokyo. So it's the first time this meeting has ever come to Asia. So very, very exciting. And for young doctors and researchers across the regions, our regions, and of course, not just in Asia Pacific, but US, Europe and South Africa, Africa's, it will be a real chance to meet the people shaping this field without crossing the world to do. Or so please join us to Tokyo. Thank you.
Sounds good. I'm looking forward for next year. Thank you so much for having and giving it some of your time today to do this interview, and we're looking forward to your session in GCOS 2026.
Thank you so much for having me.
Thank you.